Hello, welcome to our first Careers in Aging, and we are so excited that you are joining us here today. I am Jana Heyman. I am a professor here at Fordham University, and I'm also the chair of the Fordham University Ravison Center on Aging and Intergenerational Studies. And I'm very excited to be here with all of our student leaders that have helped to stimulate these discussions all around aging and focusing on careers in aging. And our group is going to be presenting, our student body is going to be giving us some insights into their stories and some of the work they're involved in doing. So on that, I'd like to introduce Ellen. Ellen is going to tell us a little bit about our first speaker, and Ellen has been instrumental in helping to spearhead this group with our student body. Thank you, Ellen.
Thank you, Jana. Good afternoon, everyone. It is with great admiration that I introduce our first panelist today, Colette Phipps. Colette is the Director of Program Development for the Westchester County Department of Senior Programs and Services. She is also the Executive Director of the Livable Communities Initiative in Westchester County. I have been fortunate enough to know Colette and benefit from her mentorship as my GSS professor and in her role as my field supervisor for both my generalist and specialist year placements. Colette inspires by example in advocating for seniors, and she encourages her students to shine and grow their competencies. Her knowledge and her expertise in all aspects of senior life enrichment and support make her a true asset to Westchester County. I can think of no one better to kick off our program today on careers in aging. And with that, let me introduce Colette Phipps.
Thank you. Thank you so much, Ellen. And I really first want to thank, Fordham University for raising awareness about the diverse careers available in the field of aging. So one thing that we do know is that people are living longer, okay, not only in the United States, but globally. And what should we do with that information? Well, we should take advantage of what Dr. Robert Butler so aptly called the longevity revolution. So Ellen, thank you for that excellent introduction. And I'll just repeat again that I do work for Westchester County, the Department of Senior Programs and Services, but I would like to add a little caveat on and say that I also work for our not-for-profit, the Westchester Public-Private Partnership for Aging Services. Westchester County has over 1 million people residing in it, okay? It has a robust older persons population. In fact, about 1 in every 5 persons is 60 years of age and older. And our 85 plus population is the fastest growing cohort of all. In terms of caregiving, we have an estimated 55,000 caregivers caring for loved ones that are 60 years of age and older. So let me begin with my story because I know my time is short and I don't want to run over, but my story is an atypical one. I was an entrepreneur for many, many years. I had always wanted to be a social worker. I was lucky enough to be able to go into the School of Social Work, not at Fordham, but NYU, but I've done a lot of work with Fordham University. I backed into my career in aging through a colleague, and I can't tell you how glad I am that I did, because this demographic transformation has provided me with like one of the most exciting careers ever. I tell everyone I love what I do. Right now, as Ellen has told you, I am the Executive Director of the Livable Communities, a vision for all ages initiative. That is the signature program of the department and the county. So you're probably saying to yourself, what's a livable community? A livable community is one that enhances the quality of life for people of all ages, and it enables seniors to stay in their homes as they age. I work for an area agency on aging. Our mandate is to make sure that people are able to grow up and grow old where they want to be. So we like to say that communities add life to people's years through features such as a wide range of recreational, social, cultural activities, education programs, and more. I've worked with Fordham University for, boy, I don't know, I want to say well over a decade. And we've worked on programs together jointly. From the beginning, when I came to the department and the not-for-profit, as a consultant, I worked on a project called the Millennium Aging Project. I was able to do that with my social work degree. And this is what I really want to point out in my talk. I don't necessarily provide direct service to clients, but I have been able to be involved, travel, write, experience older adults through this really important resource, and that is my social work degree. With the Millennium Aging Project, I was able to assist with the development of the research instrument that we used. I also worked to recruit the respondents that answered the survey. I was also trained by Fordham to lead focus groups. So my degree in social work gave me that kind of freedom. It gave me the freedom to gain additional expertise, the kind of expertise that I needed to find out from Westchester residents what it was like or what it is like to age in Westchester County. I work for the Area Agency on Aging, as I've said before. We call these AAAs, and we are also driven by policy. We're driven by the Older Americans Act, and that act supports a range of home and community-based services like, Meals on Wheels, nutrition programs, in-home support programs, transportation programs, and these programs are aimed at helping seniors to stay as independent as possible in their homes and communities. As a matter of fact, these programs help to save federal and state funds because we save taxpayers' dollars by keeping older adults in their homes. And most of them want to be in their homes. So my career with this master's in social work has allowed me to develop innovative award-winning programs. When I talk about livable communities, it has won multiple awards. When I talk about livable communities, I'm not even, because I don't have the time, to describe for you the many programs under that very large umbrella. But practically each one of those programs, caregiver coaching program, our Village Approach program, our Livable Communities, Speakers Bureau, all of these programs have won awards. I'm able to do that. I've got that social work degree. One of the programs that I'd like to share with you, our TIPS program, which is our telehealth intervention program for seniors, has actually helped to reduce hospitalization and emergency room visits for seniors because of its dual protocol that we use. And we go into affinity sites. Affinity sites, by that I mean congregate meal sites, community centers. We go into housing authorities, and we take the vitals of older people. We're now back doing that COVID was, a real restrictor, but we're back doing that now. And we have our students, mostly from Fordham University, who are working with these seniors around the TIPS program. I do want to say to you that I've also been able to travel nationally and internationally with this master's degree in tow. And I've been able to learn more and share more. As a matter of fact, I just got a response from a organization in Michigan who wants to replicate, and Ellen, you'll love this, wants to replicate our caregiver coaching program. So it's what I can say to you is that I can co-author articles, I can design, develop, implement programs. I can bring in students from Fordham University to work with me because I am a SIFI, thank goodness for that, and provide a mutually beneficial, and I hope I'm okay with saying this, Ellen works with me very, very closely, experience where you get an opportunity to see how wonderful it feels to work with an older adult. And we, those seniors, get a wonderful opportunity to experience life with a student and a younger person that they can share all, their life's relationships with. I don't know what more there is to say than having this degree and being able to stay within my niche and open doors and have doors open for me with this social work degree has been better, than anything that I know. And I invite you who are on this virtual meeting today, if you haven't considered it, please do consider. Some of you are already right there. Some of my students, hey, I want to work with older adults. Other students say, well, I'm not quite sure, but I do. And I always say this, I have a method to my madness. And my method is this: we need you. We need students. We need to build that workforce. And let's face it, with this demographic shift, be there with us, travel with us, because there's so much more to do in terms of policy, in terms of research, in terms of direct service, in terms of just being out there, gathering that knowledge and sharing that information. So I'm not sure, Jana, if I'm running over time. I don't know.
You're perfect and you're inspiring. Really, Professor Phipps, you're amazing. And we appreciate you coming to talk with us about that. And we'll have some questions at the end of the session. And I believe we're going to turn it over to Sharon, who is going to talk a moment as well. Sharon Mosley will be talking about social work and aging to her, and followed by Kathleen Lane.
Yes, thank you so much, Colette, for speaking. It definitely was inspiring. I am one of your students, so I have a front row seat of working with the older adults and the different programs that impact them. And like was mentioned, people are living longer. And I thought an interesting statistic that you mentioned was over 85 is the fastest growing cohort among older adults. And so this population has, specific needs. And as social workers, we're trained in the whole person in environment. So we can look at, the social needs, the economic needs, and then physical needs as well. And we can be that advocate, be that bridge to the older adult. Yeah, I think that working with older adults is a great career option. And so it's something I definitely want to explore after having where my field placement is with these older adults. So yeah, I'm going to turn it over to Kathleen.
Thank you so much. And Professor Phipps, thank you for launching this virtual meeting in such a passionate way. I mean, your energy and your positive experiences around this population, it's really, really contagious. So I greatly appreciate that, that intro. I'm actually coming in to my social work degree from a long career in corporate as well as nonprofit leadership, but I've always been drawn to wanting to pursue a degree in social work. I find that working with older adults provides an opportunity to connect deeply with them in ways that they feel support, and they also have a wealth of life experiences and their own perspectives to share. I'm incredibly interested in pursuing and being an advocate on the macro level for clients, and working and developing client-centered community programs that can improve older adults' ability to deal with their social isolation, their chronic, life-limiting, and advanced illnesses. And actually, overall, I can think of nothing more gratifying and rewarding than to experience working and making a difference in these people's lives.
Thank you, Sharon and Kathleen, really to share your stories and your passion. It's so critical for us to be aware of students and your experience in the field. I'm going to turn it over to Leroy Moore, who is going to talk a moment and introduce us to our next speaker.
Thank you, Dr. Heyman. And thank you for the opportunity to be here, and also Dr. Berkman for her referral in her absence. I'm currently hello everyone, I'm currently a GSS-MSW student, Lincoln Center location, fulfilling my intern requirements at the Bronx Veteran Hospital, paired with Mr. Nicholas Koufacos. Nicholas Koufacos is a licensed clinical social worker, advanced clinical hospice palliative social worker, and the senior education specialist at the VA Geriatric Research Education and Clinic Center, known as the GRECC, located in the Bronx, New York. He serves as the dementia care coordinator and provides educational programs for VA staff in Vicent 2, New York, New Jersey, and caregivers across the nation. He is an NYU School of Social Work graduate, and he completed the Zelda Foster Fellowship in Palliative and End of Care while in NYU. Nicholas completed his NYU postgraduate certificate in Palliative and End of Care and is an interprofessional palliative care social work fellow at the GRECC. He has worked as a social worker in both the private and public sectors. Presently, his focus is providing care coordination and support to patients with dementia and their caregivers by incorporating patient empowerment and promote self-care. I have the honor and the privilege to work with Mr. Koufacos, whether if it be on caregiver support whose family member has dementia or PPC, what matters most to the patient. Nicholas is always available and full of knowledge and wisdom and plenty of patience for me. Nick, you know I appreciate it, and I will never be able to say that you did not equip me with detailed information and a clear focus. Nick has taught me to never leave a room without my voice being heard. You speak for many other social workers. Nick, you are great at what you do, and it is a pleasure of mine to be your student. Ladies and gentlemen, I present to some and introduce to others the staunch stalwart, Nicholas Koufacos.
Oh, you're an amazing intern, Leroy. Thank you for that introduction. I'm really touched. It's been an honor working with you, and as Leroy mentioned, I'm fortunate to be working at the VA with the Geriatric Research and Education Clinical Center. So Thank you, Jana, for inviting me and for Fordham University for having me. This is really exciting to share about careers in aging at the VA. The VA, as many of you have heard, is known as one of the, if not the largest integrated healthcare system in the country. And by consequence of that, the VA is the largest employer of social workers in the country among many estimates. And so what's it like to work for the VA as a social worker? Well, as Leroy pointed out, you know, working for a national federal organization as a social worker has a lot of benefits. One of them being that you can use your state license anywhere in the country. So I am licensed in the state of New York, but if I wanted to transfer to Oregon tomorrow, I could do that and keep my New York license. So that's a perk of the VA. A lot of social workers in the VA, they move around based on opportunities, and you really do have that national reach with that ability to kind of look at what jobs are available across the nation. I get emails every day on different jobs, and it's interesting. So that's one factor. The other exciting thing is that we're part of these national projects, and we can collaborate. So I collaborate with social workers across the country, and it's really fun to do that. I have committees with social workers in San Francisco and rural Idaho and Florida. And it just is exciting because you learn about what's going on across the country, and you get to network and collaborate with your peers across the nation. So that's a really fun part of being a social worker at the VA. But the VA does have a national program called Geriatrics and Extended Care. The VA works with acronyms. Everything is shortened, so we call it GEC. And the GEC funds the jobs in aging across the VA network. And one of the biggest places that you might find work is in what we call the CLC, a community living center. That's what the VA calls their nursing homes. So in the state of New York, we have the most number of CLC beds in the nation, which shows you the veterans are aging just like the regular population is aging. And in the VA, if you're working with geriatrics, you'll probably work with veterans from World War II, Korea, and Vietnam. And that's another great thing about working at the VA is you get to work with veterans and learn about their stories and their amazing experiences. And really, I learn every day from veterans, their selflessness, their courage, and unfortunately, they do have a lot of struggles. And as they get older, our veterans can be very isolated and need advocacy. Leroy has been a great advocate for our veterans, and so it's a wonderful place to work with veterans who are older and need our help. So we have those nursing home jobs where you'd be working with veterans who are living at this community living center. And we also have a big department called home-based primary care. That's one of, I think, the best benefits the VA has to offer for older veterans. The VA works as a system where primary care is essential. You, as a veteran, if you were going to ask me, how do I get connected with the VA? I would say you have to get connected to a primary care provider. And the VA offers home-based primary care. So this is a great way for social workers. Social workers work within this home-based primary care. They visit veterans at their homes. They do assessments. They help link them to community resources. They serve as strong advocates. The VA is a large system. There's a lot of benefits, and a lot of veterans don't know what they're entitled to. So one of the biggest functions we serve as social workers within the VA is really educating veterans on what benefits they're entitled to. So for example, if you're a home-based primary care social worker, you go to a veteran's home and they say, well, you know, I don't have this medical supply, I need a hospital bed. You know, we have to be aware that the VA provides that. A lot of people don't know that the VA has a prosthetics department, for example, that provides amazing services with medical equipment for veterans that Medicare does not cover. So things like walkers, canes, adult diapers, gloves, the VA provides that. So social workers are really a great resource for veterans in letting them know, oh, well, you're entitled to this service, so let me help you get connected to that. We also have in our primary care, geriatric primary care. So those veterans who are older, they get placed with a geriatric specialist. And as part of that team, you'll have a geriatric social worker, a specialist. So we have geriatric primary care. And then we have a big department within the VA called the Caregiver Support Program. As was mentioned, caregivers are, you know, amazing, doing wonderful things, New York, New Jersey, this region, but they're also very stressed and they have a lot of burden, and caring for an older veteran, and some of our veterans are caregivers. So we have a caregiver support program, and that's a big employer of social workers. So within that department, our social workers work directly with caregivers, either on a helpline where they'll answer calls, or they'll do counseling, or they'll run groups, support groups. So the caregiver support program is a wonderful service, and that's where you'll find a lot of social workers working within the VA. So those are some of the dedicated areas within aging, but sometimes as you know, recent graduates, it may be something where you might not find that specific job that you're looking for, but others jobs within the VA, you'll work with older veterans because of the aging population. One of the biggest employers of social workers within the VA is the HUD-VASH program. All of you have probably heard of HUD, the federal program, but VASH is the VA side of that. The VA has made a big push since President Obama to end homelessness among veterans. And so that is a major employer of social workers, that HUD-VASH collaboration, where all across the nation, social workers are working with veterans who are unstably housed or homeless to get them into housing, and also provide counseling, therapy, wonderful array of services. So it's not just that, okay, now you're placed in a home, we'll kind of, you know, see you later. Our HUD-VASH social workers do an amazing work, visiting veterans at home, doing assessments, therapeutic interventions, and continuing to work with veterans. And as I mentioned, that I've talked to HUD-VASH social workers, and the veterans are getting older. So that is an area where you might not see that as a dedicated position in geriatrics, but you will be ending up working with a lot of veterans who are older. Of course, we have our inpatient medical units. That's a very rewarding job, very challenging, either on the inpatient unit or the medical floors. As a social worker on the inpatient unit, it's a very high-paced work environment where you're helping veterans connect them quickly to resources, doing safe discharge planning, helping connect them to a short-term rehab or home care services. So a lot of assessment, a lot of intervention, maybe not so heavy on the doing therapy, traditional therapy with veterans, but our inpatient social workers work tremendously with older veterans. And then we have a geriatric psychiatry department. So a lot of older veterans who have dementia, they'll be referred to a geriatric psychiatrist, and we have social workers there. So I hope I've been able to give a very brief overview of some of the opportunities. I think the summary of the VA is it's a very large employer of social workers. There's a lot of opportunities across the nation, across the region, to use your New York license. And so if anybody's looking to travel, you can use your New York license wherever you go, and you can collaborate with social workers across the country. So thank you again for having me, and I hope you enjoyed this presentation.
Thank you, Nick. And we really appreciate you coming to speak with us and to give us insights into the rich experience. And thank you, Leroy, for that introduction and about your personal experience being placed there. We have two students that also wanted to present about their aging and interests. Michelle will go first, and then Amanda.
Hi, everyone. And first of all, thank you so much, Nicholas. That was really also inspiring. And, just for letting us know all the opportunities that are available at the VA and for all that you do. It's really very, very inspiring. As a student, I can speak to why I think a career in aging is important and also personally fulfilling through my own experiences that I've had at both my internships here at Fordham. My generalist internship last year was at the Westchester County Department of Senior Programs and Services. I was a social support associate. It was with the Tips in Touch program, which was what we had to do during the pandemic. I provided outreach to seniors via telephone, most of whom were fairly isolated due to the pandemic and the lack of in-person activities available. But through our weekly phone calls, I was able to form meaningful connections with our clients who truly appreciated the opportunity to engage. I was struck by their resilience, not only through the pandemic, but also through all the challenges of life that one faces in general when you've lived a long time. It was both inspiring to me and gratifying to work with this population. I felt that my clients had so much to offer me through sharing their own life experiences, and I learned so much from them. I'm currently working at an NYU Langone outpatient neurology practice. In the practice, we provide supportive counseling, support groups, and connections to resources for our patients and their caregivers. We're bringing the social work component to the medical practice. And our goal at the practice is to be supportive, to help those as best we can to live their best lives, giving their individual challenges, both physically and psychologically, that come as a natural part of aging. In this setting, it's also gratifying to work with older adults. We get to see the positive results in our patients when they're given the recognition and the proper support and attention that they need. So I can say through both of these experiences, I've learned a great deal about aging. I know it is a continual process that we're all experiencing, and we have so much to learn from those who are further along the path than we are. So thank you.
Hi, my name is Amanda Kleinberg. It's very nice to see everyone, and thank you so much for everyone who has spoken so far. Everything has been very insightful. I am in my last year of the graduate program for social work at Fordham University, and my journey with working with older adults actually started in high school unknowingly when I would go and intern with my mother, who was the director of social work at a nursing home. So this started way back when, and then I joined the social work program and initially was like, I am never going to work with seniors. This is not what I'm interested in. I wanted to create my own path, work with a different population. But then I was actually placed at Project Find Woodstock Senior Center. And this changed everything. I was able to work one-on-one with seniors. I was able to, like Michelle said, make phone calls, really hear about how everyone was dealing with the pandemic and COVID in their own way. Everyone was, a lot of seniors were very, very isolated. So just having that phone call and that human connection was really, really helpful for them. And it was even helpful for me too. I felt a lot of satisfaction from it, and gratification as well. So at Project Find New York Senior Center, they provide meals, housing, activities, and it really tries to strengthen the senior population to feel independent and continue living in housing that's not a nursing home or an assisted living center. So this is actually my second year now at Woodstock Senior Center. I decided to go back for a second year as I realized after that first year that working with aging and the senior population was something that I was going to be continuing. And at the same time that all of this was happening, actually my grandmother was diagnosed with dementia. So it all kind of came together, and I just became extremely passionate about it. And it was very unexpected. So I just want to let everyone know, you may think you want to do one thing, but it might completely change. So just to keep an open mind.
Thank you, Amanda. And I think all our students are really sharing some very passionate stories about why they are in aging and why they see it as an opportunity for their future careers. Tatiana is going to introduce our next speaker. And Tatiana, I'll let you start.
Thank you. I'd like to start off by saying a big thank you to all the speakers here today. It's been an incredibly insightful meeting, and I really appreciate everyone's time. And also a big shout out to Dr. Heyman for pulling this whole event together. We really appreciate you doing this for all of us here today. Last but not least, it is my pleasure to introduce Allison Mann. I had the great pleasure of having over an hour-long phone chat with Miss Mann about her career in geriatrics and geriatric social work, and I am eager for her to share all that information with you here today. Miss Mann was inspired by an incredibly close relationship with her grandmother and began her career in geriatrics at the ripe age of 15, volunteering in a local senior center. After some time spent as a recreational therapist, Miss Mann graduated from Fordham GSS with an MSW in social work in the year of 2000 and began her career as a director of many nursing homes around the New York area. From there, in 2015, she shifted professional gears and now works in the private sector as a geriatric care manager. Miss Mann, take it away.
Thank you, first of all, for having me. I am so honored to be here. It's funny that Amanda was saying you may start out as one thing, but you may end up as another thing. When I was 15, I volunteered at a nursing home through a community service organization in high school called Key Club. And it all started with a friend of mine just asking me what I was doing one Friday afternoon. And I said, nothing really. She said, do you want to volunteer with me? And I said, sure. I was scared to death going in my first nursing home. And as I entered the facility, I began to talk to some of the residents on the Alzheimer's units. And it was kind of fun. And then I became the head of the volunteers through my high school. And then I went on to being a receptionist at the same nursing home. And then it's all about who you know too. Networking is very, very important through all of your experiences, but I'll talk about that in a minute. I was determined to be an accounting major. I actually did attend a business school, and it wasn't until I had a resident at the time who was 89 and all of about 4 feet tall. And she told me that there was no way I was going to be an accountant because I wasn't the type. And I said, okay, but that's what I'm going for. She said, no. So I told her after I switched majors, I went into human services with a concentration in geriatrics undergrad. And I really learned a lot through the internships I had, doing different tasks in nursing homes, in independent living facilities, all different types of environments. And after graduation, I became a recreation therapist doing therapeutic activities within the nursing home industry. And I realized that I really wanted to do a lot more at that point. And that's when I went to Fordham back in 1997. I went to Fordham in what was Tarrytown at the time, and which is no longer. And I went for a 3-year program. I got my MSW. And as I graduated in 2000, I started a series of director of social work jobs in many different nursing homes. And through all these long-term care experiences, I have to say, I learned the bulk of what I know now. And I think it was a really, really good experience to have, especially in the career that I have now. After I got out of school, I didn't take my exam right away. I do urge students to take the exam right away because I waited 15 years because life got in the way. So yeah, that is one thing I do recommend. So after these director of social work jobs, I became a little bit disappointed because the job wasn't really hands-on anymore. It really veered away from being able to spend that one-on-one time with residents and veering off toward more of the paperwork, more administrative stuff. And it became something that wasn't fulfilling enough anymore for me. So through all the networking I've done over the years, I came across who is now my boss. She has a private geriatric care management / psychotherapy practice. And she helped me learn the ropes of being a geriatric care manager. What a geriatric care manager does, you can be a social worker, you can be a nurse. I happen to be a social worker. You help people in the community. It's a private pay basis, and you help them oversee their plan of care or manage their care, whether it's in the community, whether it's in a nursing home, assisted living, wherever they may be. And we advocate for them in emergencies and hospitals, at doctors' offices. We do a lot of coordination with doctors and a lot of medical teams. Our goal is to make sure that they get the care that they deserve and that they should be getting. And that is my true passion. And because of the relationship I had with my grandmother, I wanted to give that back. She died very early in my life, and when I was only 17 and she was only 72. So she was really a true inspiration for wanting to give back. And I am so thrilled being able to do what I want to. I love what I do. As crazy as it gets, I love what I do. And what is great is that sometimes you don't realize how much of an impact that you can have in the private sector, that you can have, rather than being in a facility. Let's say I have been with clients at every change in their life, every up, every down, really getting them better or helping them die with dignity, just providing the best care possible, really just all aspects of their life. And it's so rewarding and so fulfilling. And I've been doing this for 6 years now, and I'm very happy with what I do. So I think it's very important to feel the intrinsic reward that we social workers often feel. And I think it's very important to have many different experiences. You know, as I had as a volunteer, a recreation therapist, director of social work in many different nursing homes. I think all of those things are very important to bring with you on your journey to where you end up in social work.
Thank you so much, Allison.
Oh, you're
your history and really the path that you took really led to a lot of experiences in working with older adults and their families. And I know that's going to continue to help and build lives for many individuals. Thank you. And I'd like for a moment just to, before we open it up to questions and answers to our panelists, I want to thank Connor White for really being here to help organize this. And I would I appreciate all the time and effort I know it gets to put in together a group, and really to our students, because the students just sparked an interest when Ellen and Tatiana started talking about getting a group together. And then all of these amazing students came together to help pull the panel and to give their words and insight. And I'd also like to thank Dean White-Ryan, who has done a lot to support our aging. I know she might say a word or two, and then I want to recognize our faculty members, Dr. Kathy Berkman and Dr. Horowitz, who are also here with us today. Dean White-Ryan, did you want to mention? Oh, and you're on mute, of course.
Thank you so much, Jana. Yeah, it's just such a pleasure to be here and to see so many people that are interested in the field of aging. And I want to thank both the speakers. You were inspiring, and as well as the students for your interest. I think what really shone through today in all of your presentations is a number of you mentioned, I think Colette and Sharon mentioned, that older adulthood, it's the fastest growing segment of the population. And what really came through was the varied areas. There's so many jobs available for social workers. I think social workers can make such a contribution to the quality of life for older adults, but there are so many different areas that you can work in. So thank you to the speakers. What did come up though, for me, I was a psychiatric nurse before I came to social work school, and I worked with adolescents and their families. And when I came to social work school, I said, well, I'll do something different. And I had 2 internships, both years, with older adults. And the most amazing thing, besides what I learned and listening to the lived experience of all the seniors, was they were always happy to see me. And I had not always experienced that with adolescents. So it's an amazing field. And thank you, Dr. Heyman, for bringing us all together.
Thank you, Dean White-Ryan. And Dr. Berkman, do you want to just share a moment? Because you really have been a leader in our community.
Oh, thank you, Jana. It's so wonderful to see so many students here. You know, when I started my MSW program a million years ago, I had 0 interest in aging. And I only got into it because we had to do a thesis our second year. And I just chose this group because I liked the professor who was a leader in aging, I came to learn. And I was just hooked. It was such a rewarding experience and I never left. And you know, I think what some of the people have said about how rewarding this career is, and you know, a lot of people have a very warped view of what working with older adults is, but it is as varied as any area of social work that you could think of. I mean, I'm more specifically now in palliative care, and even that is so diverse, so many different settings you can work in. And I see one of our current fellows is there and a few other people who've been in touch with me. So I just really encourage you to stay with this field. I think you'll find something that'll be so rewarding. And, you know, if anyone has any questions for me ever, I'll put my email in the chat. I welcome you to get in touch. Be happy to talk with you.
Thank you very much. And Dr. Horowitz, are you able to just say a few words? We heard a lot about caregiving today.
Sure. Sure. I actually got into aging after my master's degree. It was my first job and I was in research practice. And I was basically assigned to a project that had to do with older adults and income supplementation. And I enjoyed it. I enjoyed the issues. I enjoyed the varied experiences that older adults do have and that they shared with us. And then when I got to my doctoral program, it was, okay, what do you want to be? What do you want to focus on. And I thought, well, I know a little bit about aging. I'll say that for now. And then who knows what'll happen. But it stuck and I stayed with it. And a lot of my research now is in caregiving, really families' relationships with older adults who have some cognitive or physical disability that requires, families to be involved. And as in the work at the VA, a lot of them you discover are really experiencing a lot of difficulties. They're stretched very thin, and they need support just as much as their older relative does. So working in aging really means working with families. And that's what I've discovered. So you could be you could be dealing with issues that adult children are having, older siblings are having, older spouses, and it's again very varied. It's they say aging is a family affair, and it definitely is in more ways than we know. So I'm gratified so many of you are interested in a career in aging. I think it's the place to be. I think it's going to be where a lot of the cutting edge practice innovations are going to take place. And I welcome you all and hope to find you as future colleagues.
Thank you so much. And we'll turn it now back to our students. Tatiana, you were going to start and we were going to ask some questions of our panelists, correct?
Yes, thank you. So this question could be answered by any panelist or any professor that's here with us today. I know that me and many of my fellow students here are looking for a long-term career in aging, but we're just out of the gate. And next May, we're going to be starting off as fresh social workers. So I was wondering if any of you could share any insight as to the best, quote, in the trenches type of job that you think will build a great foundation for the rest of a career in geriatrics, be that in a clinical space or perhaps in a direct practice space. What do you recommend?
Can I sort of answer that? You definitely need to experience stuff. So like talk about in the trenches, really experience different things. It's hard to say what direction that you'll end up going in. But I think you should be open, like have an open mind to anything pertaining to the aged. So I think the experience is important and networking with people. I really highly recommend going to networking events. If you work for a company, let's say, attending their seminars, attending workshops, attending any kind of networking event. And you get to know people in the industry and you get to see different types of jobs and what some people do, and you connect with many different kinds of places. And I think that's really important to guide you as to where you want to go.
Thank you. Colette, did you want to add to that?
Yeah, I did. And I absolutely agree with everything that Allison has said. I would also say that you might want to join various associations. Mm-hmm. So that you can learn more really important State Society on Aging, American Society on Aging, Leading Age. All of these organizations will really open up your mind. There are beautiful publications that are out there, and certainly you want to be part of NASW. But the network, I know here in Westchester County, pre-COVID, and now we do mostly everything virtual. We have a wonderful network, and we would meet regularly. So that networking, I can't tell you how many students I know that have gotten jobs through that network. And just let me say one thing, most of the people who work with me right now and that are on my team were my students. They were my students. So you show promise, you show interest, you're eager, you're willing, and you'll find a place.
Thank you, Colette. Was there any other questions or?
I'd like to ask a question if I may.
Sure, Elizabeth, thank you.
Forgive me, I was a little late to our meeting, but I'm wondering, would anybody be willing to speak to the spirituality component of this work?
Yeah.
Okay. Colette, did you want to?
Well, you see me going towards the.
I thought she was going to jump out of the Zumba.
Yeah. Well, just let me say to you that the spirituality of this work is huge. When I am working with, and I don't, I talk to lots and lots of caregivers. I do a hodgepodge of things here and what's, in the Department of Senior Programs and Services. But more than not, I have seniors who are very much into their own spirituality. It may not be a particular religion, but it is of a spiritual nature. So I would also suggest that you kind of bone up, in that area, because it's very important. And I'm not stereotyping, but I will say to you that many of, and especially our old seniors just come from that. They come from prayer. They come from meditation. They come from just spiritual nuances. And it's really important that we recognize that, respect that, admire it, and know something about it.
That's excellent. Thank you so much, Colette. I truly appreciate it. This finding social work after so many years of doing so many different things has felt like I finally found my tribe. And so being able to have that openness and being able to bring that component to this work is so exciting for me. Thank you.
Thank you, Elizabeth. Are there other questions as well?
I have a question.
Is that Hannah?
Yes.
Hi, Hannah. Nice to see you.
Thanks. I actually am in Fordham's online MSW program, and I graduate next month. And something I've been working with seniors living in public housing, and I've really enjoyed running support groups with them and different grief groups. So I'm interested if you guys have any advice on how to find jobs specifically doing group work, because I haven't seen that mentioned in a lot of job postings.
Okay. I don't know if Nicholas wants to add that, because I know you've been involved in a lot of work.
I apologize. I was answering something in the chat. Can you repeat the question? Sorry.
Oh, a group work. Hannah is doing work and is interested in advancing her career when she graduates next month. Congratulations, by the way, Hannah, about doing some work in group work. And I know the VA has a lot of groups that you are very active in running and involved in.
Yes, definitely. I was just answering about the VA with our whole health department that will be interesting if anybody is interested in spirituality. We have a big initiative nationally, and in the Bronx, we're really leading the way in a lot of ways with our whole health, which is basically saying that a person is more than just their illness, and looking at the whole person. And that also relates to our older adults, because often they're just kind of, they go from person to person, provider to provider, but does anybody ask the question, tell me about you? What's important to you? That's really the whole health approach. So with group work, I do a group on Mondays for stress reduction. And yeah, there's so many different groups operating throughout the VA with the whole health approach, with veterans who have PTSD, caregiver support groups, diabetes support groups, smoking cessation. I mean, you name it, there's probably a group. So that is a wonderful way in terms of talking about how do I get in the trenches and learn. Running a group is really a fast track to learning about all kinds of things, because when you have a group, you learn so much from the group members. So in terms of getting in the VA, specifically to run a group, that might be difficult. I mean, the way that it often works is you find a job within the VA, and then once you kind of get your feet settled, then you have opportunities to join committees, to run groups. Like I'm running this group. It's not my job description, but I can say to my supervisor, I'd like to run this group. And so that's really how it works. You kind of find a place at the VA, and then from there, you follow your interests, and you really set up your own path that might be totally separate from your quote unquote job.
Thank you, Nick. Thank you. And I know Ellen had her hand up. You were going to ask a question as well. So
I did. I just feel there's so much opportunity here with all of these students that are expressing an interest in a career in aging. And maybe the question is for Nick, but really for anyone. I know how invested Colette is in student interns and field placements. Is there a great opportunity for students to secure field placements in places like the VA and other specific, older adult populations to sort of feed this interest that Fordham students have in working with this population? We need to have them exposed to the population in real work situations, and then that kind of builds the career path. So just a question for anybody. Nick, do you have, I know you have Leroy, do you annually take in a lot of student interns, MSW?
Yes, the VA is really, really great. We have a vibrant student internship program that also has stipends for students. So they get paid, not a lot, but there is a stipend attached. I know Leroy was very proactive in securing this placement. I'm not personally involved in that process. We have a social worker who's in charge of our student program, but I would definitely say yes. And I know here at the GRECC, I could use even more students because we have so many different projects. So absolutely, I think the VA is a wonderful place for students to learn.
I would agree. Thank you.
thank you. Did anybody else want to respond? I know Colette, you take a lot of students as we in the process, which has been very valuable for their learning experience. So thank you. And thank you everyone for all your support for students. Are there any other questions?
I had a question. My name's Kirsten. Hey.
Yes, welcome.
Thanks. So we've been talking, obviously this area is so rewarding. It's been so clear. And I was just wondering to our panelists if you had a magic potion and could change one thing. Or what do you see as like a barrier, right? What is the thing you would love to be able to change?
Oh, that's a loaded one. Yeah.
Sorry, I'm just curious.
No, that's okay.
What do you feel like you can advocate more? Like how can you advocate better? Like what's the thing you would love to change? You'd be like, this would be amazing.
I think some of my clients are not as elderly, but maybe this is getting into another field. The mental health of the elderly and also resident rights within where they are. I came across some barriers in that years ago, and I advocated for my residents. I wasn't going to let any kind of rights or whatever be violated in any way. My social work muscles went to work. But it's funny because a lot of people think that social workers work magic. I'm still told this to this day. I do have a mug that says Miracle Worker. I used to keep it on my desk in the nursing homes I was at. And I have a 25-cent magic wand from Party City in my mug that says Miracle Worker. And I would tell people as soon as I get my license, that wand may work. But yeah, there's a lot of things that I would love to have be different. I would love to have places invest more in the care of certain places whether it's assisted living, whether it's a nursing home. But those are some of the things, and also just advocating in general. You know, I do advocate a lot medically for my clients. I work with doctors and other specialists sometimes, even in the hospital settings. When my clients are in the ER, we're always advocating for them. And I think that's just an important thing to keep up so that you do make those changes. I think that's really, really important, is to make sure that you are advocating and you continue to advocate for your clients or your residents. Because that way, sometimes changes happen that way. Not always easy, but definitely just never give up on that.
I think Colette and Nick, did you want to respond to Kirsten's?
I certainly would. Advocacy is so important, and Kirsten is one of my students, so I know she is going to be a great advocate. But we're social workers, but I'd like to, and I tell my students that I'm not looking for you to do social maintenance work. I'm looking for you to do social work. Okay, so, and that means more teeth, more advocacy, be interested in research. I have so many students, oh, I don't like it, I don't like it. Be interested in policy, because policy is all that means. That's how you are able to serve a client. So, and we all know that these things sort of, you know, they ebb and flow. So it's just a matter of just being strong, being resilient, advocating, and as a student thinking about advocacy. It's important. My students say, I want to help people. Well, okay. And you want to help people to help themselves. So when you start thinking that way, that's when you're doing real social work.
Thank you. Nick, did you want to add to that?
Yeah, it's a great question. On the macro level, I would love to see a change in how we see older adults, our image of older adults. I think we know about age discrimination. I think that comes from a place where too often in our society we see older adults as useless burdens. I think that's a terrible thing. So that at the broad level, if we could change the way we see our older adults and revere them more and see them as teachers and guides, that would be wonderful. On a practical level at the VA, I think our older veterans and across non-VA are suffering from a lack of home health aides right now. A lot of our older adults need support at home, and we have a shortage of home health aides, and Medicare doesn't cover long-term care services. So I would love to see a change in that, whereby more older adults are able to utilize home health aides or have their caregivers be able to fulfill that role and be paid for the caregiving that they're doing, so that they you know, because they are really acting as a caregiver like an aide would, but they're not being paid for that. So those are a couple things that I would like to see changed.
Thank you so much, Nick. And I know we're getting close to the end of the day, and Tatiana, you were going to, I think, close us. And we kept on schedule. Do we get, can we give a round of applause? And Tatiana has a message to, thank you, everyone.
Yes. Again, just a big thank you to everyone who joined us today, and all the speakers and professors and Dean White-Ryan for joining us. If there's interest from all the participants today, we would love to have another panel perhaps in the next semester and delve into other aspects of geriatric careers. So if there's interest in that, please feel free to shoot me or Dr. Heyman or Ellen an email and let us know what you would like to see in coming events.